Well, hello and greetings. My name is David Tesmer. I'm the Senior Vice President of Advocacy and Community Benefit with Texas Health Resources. My team in my area is responsible for the keeping our proactive pulse, if you will, on the public policy issues that affect Texas Health Resources and also the communities that we serve. Well, I'm sure most of you are aware of the health care reform bill that was signed into law by the President yesterday, on Tuesday of this week, better known as the Patient Protection and Affordability Act of 2010. And I'm sure a lot of you have read quite a bit of information or seen quite a bit of information about it. Let me just basically kind of summarize a few points. I think it's very easy to say that this is probably the most historical and sweeping legislation in terms of health care reform that we've seen. Many have said since the passage of Medicare back in the early 1960s. Really the major focal point of this bill is to provide insurance to 32 million of the currently 47 million uninsured within our nation. And if you really want to look at it, it expands that through what we would call a combination of private and public insurance expansions. Another important component of the bill is to put into place some very important insurance reforms that will go a long way towards providing coverage and access for those within the nation. I think it's important to note, too, that with Texas we have 6.1 million uninsured, so Texas leads the nation in the largest percentage of uninsured with about 26%. So the bill will provide quite a few Texans with insurance coverage. I think it's also important to note that the legislation has what we would call a comparatively long-term implementation period. It's a 10-year bill in terms of its implementation. So what that means is many of the provisions that you've already read about or that you will hear about really don't go into effect until 2013, 2014, all the way through 2018. So a really long-term implementation. And that clearly means that we don't know a lot of the impact because there'll be rules and regulations that'll be written by the Health and Human Services group out of Washington, D.C., including also some of our state regulators. So there's a lot of work yet to be done. The impact we'll be continuously working on to determine what it means for Texas Health Resources, but also what it means in terms of the communities that we serve. One way that you can keep up to date is our healthcare reform website that we have posted, and you can get access to that website. Also, you can contact myself or my staff at any time if you need information, and we will continue to provide updates. So I would say, or I'd ask you just to keep posted and be aware that we'll be providing updates on healthcare reform either through the website or through maybe some of these updates that we will be providing to you on somewhat of a routine basis. So more to come. We will keep you updated, and we will continue to look at how this legislation impacts Texas Health Resources. So thank you for your time, and look forward to talking with you soon.